Hey, Jim Hoffman here from EMS Office Hours. This is your Monday Minutes. Guys, thanks for joining me for another quick EMS study tips review here. And today we're going to be talking about burns a little bit more. And today we're going to kind of focus in on severity of burns and kind of general management, okay? Before we do, I always like to talk about why this stuff is important, right? Yes, great for exam. This is stuff you can review to help you kind of refresh your memory, delve deeper into things you might not know, right, when you're getting ready for an exam. But it's also there to build your knowledge base, okay? So like I said, if there's something that's not ringing true to you, you're reviewing this video, and you're like, wait a minute, that doesn't sound right, Jim, or don't really remember learning that in class, go open your textbook, use a resource like My Turbo Medic, use a review guide, use an app, whatever it is, to go ahead and build your knowledge base, move your knowledge needle a little bit more. And of course, this is great to help you make better clinical decisions out in the field, write better reports, and interact with your fellow healthcare professionals, whether it's a doctor, a nurse, or even your wise-ass partner sitting next to you in the ambulance, right? So let's get into it today. Talk a little bit about this whole thing with burn and the severity. All right, I like to talk a little bit about the kind of moderate, major, minor type of burns, right? We talk about, I'm not going to go over each one of these. It'll take too long for these short videos, but you can pause it. You can kind of look here of what we're talking about, right? We talk about the full thickness burns, partial thickness burns, or superficial burns, right? When you talk about minor, you can see less than certain percentages here will kind of help that burn fall into a minor sort of category. When you talk about thickness burns that are 2 to 10%, or superficial burns that are greater than 50%, now you're more into the moderate range of burn, okay? And then you've got your major burns. And we talk about more about thickness here with greater than 10% for full thickness burns, partial of greater than 25% body surface area. When we talk about the percentage, guys, this is the body surface areas. And that's when we talk about rules of nines, or the palm method of determining that, right? But one thing I want to mention here, we talk about major or critical type of burns and the severity of the burns, right? Also have to think about things like burns that are to the hands, the airway, the face, the genitalia, okay? Patient's age, like over 55 or under 5, and pediatrics that have greater than 20% body surface burns, okay? So just some things to think about here, okay? When we're looking at the burn severity. All right, now I want to go a little bit more into this. All right, and some things you need to be considering when you're assessing your patients. You're asking questions to yourself, questions to the patient. Right, what's the depth of the burn? Right, what is the extent of the burn? Again, rule of nines or rule of palm, and the palm is the patient's palm. That's how you figure that percentage out, not your palm, right? But most of us usually use the rule of nines, and then the palm method we use as sort of a secondary thing, or as we have more time to kind of get a better idea of what the body surface burn percentage is, right? And again, like I mentioned, the critical areas, right? Hands, face, genitalia, the airway, are they involved, okay? You want to upgrade the classification if that's going on. You want to upgrade it as well if you've got patients that have pre-existing conditions, diabetes, cardiac issues, okay? Respiratory issues, right? Upgrade that if they have pre-existing medical condition. And like I mentioned in the previous slide, think about the patient's age. If they are under 5 or over 55, you want to upgrade that classification as well. Think about other things that might be going on and the dangers that are involved. Now I want to just talk quickly about the superficial burns here, okay, and the kind of the severity here. When we talk about superficial burns, right, this is when there's no blisters happening, okay? You're not really seeing blisters with these type of patients, right? But usually only involves the epidermis, right? It's the irritation of that living cells of that region where it's burned, the arm, the chest, maybe things like that. So what symptoms are going to be pain, some swelling, some redness, okay? It could be very bright red skin as well, the sunburn type thing, right? But you're not really going to see blistering or whitening of the skin with the superficial burns. Now, partial thickness burns, this is where the burn is penetrating the dermis, right? And you can kind of tell the difference between this and superficial because you're going to see some blistering of the skin, all right? But most of the time, complete healing of the skin may be possible, all right? And this is much, much more painful than a superficial type of burn. Now, your full thickness burn or the third degree burn, right? This goes all layers, right? It's below the dermis, right? Probably all the way, it can be even all the way down to the bone, all right? Healing is much more difficult, often even impossible, all right? Your symptoms here, this burn can be pure white, black, or even kind of leather-like in appearance, right? And this is when you've got damage to the nerves, all right? And this is when your patient might not even be in any kind of pain to the actual site of the burn, all right? They'll be in pain from the surrounding areas, but not in the actual part of the burn, all right? So you're going to have the full thickness burn in one area, but then surrounding areas are going to be kind of partial thickness. So, of course, they're going to be in pain. All right. Now, some people, you talk about things you might have heard of. I want to just mention is a fourth degree burn. This is that burn that really penetrates down into the muscle, into the down into the bone. Okay. So third degree burns that fully destroy the dermis and epidermis, but not the underlying tissue. Okay. So you get that fourth degree where it's more down to the burn into the bone and the muscle, but some people say third degree burns, it might not be down to the muscle, depending upon your area, what your medical director says, what your guidelines say. It might be how it gets presented, but usually it's first, second, third degree is what we're talking about here. Okay, now talk a little bit about management. I put a picture here of the rule of nine just to kind of give you an idea here. But of course, we talk about the issues when it comes to managing. It's pretty basic stuff we're doing, right? We're using the scene safety, our BSI, we're controlling that airway, all right? Maybe intubating patients with suspected airway burns, right? We don't want that airway. I mentioned in the previous video about the airway swelling up. We don't want that to happen, so you might want to intubate early on if they have suspected airway burns, right? Thinking about things like stopping the burning process, right? Local cooling, stop the burning from happening. Remove clothing, going to prevent further injury. Try to remove clothing that may constrain the swelling that's going to happen from the burn, right? Don't let that clothing be something that's going to constrict the area on top of the burn. So remove clothing if you can. Okay, cover the burn. I put it, use a clean technique. That means covering the burn. Sometimes, depending upon protocols, guys, usually it's dry, sterile dressings followed by moist dressings. It depends on where you are. Nowadays, it's more of the dry, sterile dressings and transporting them, right? Because when you put the moist dressings on top, now you've got an issue with body temperature and body heat and the patient maintaining their body temperature, right? So keep that in mind when you're doing that. But of course, follow your local guidelines. And then of course, we can give fluid as well as needed. All right. Sometimes patients, you can start an IV, you can give them fluid as well. And again, don't forget, guys, manage that airway. If you can go ahead and transport them to the appropriate burn center, try to manage their pain. Okay, again, third degree burns, you probably won't have pain for the burn site, but your surrounding areas are going to have more of a partial thickness burn. They're going to be in a lot of pain, so you're going to want to try to do some pain management if possible. Okay, guys, lots of stuff to think about. Lots of stuff is basic. Trauma is not that difficult. It's just acknowledging the different versions and the mechanisms of trauma and mitigating what's going on there, right? A lot of times, not a lot we can do, but when it comes up like burns, stop that burning process, remove, prevent further injury, removing clothing, using the clean technique, get into the hospital, and don't forget, manage that airway. Keep an eye on the airway if you've got facial burns or inhalation type burns, keep an eye out for that airway. You might have to aggressively manage it. It might be more than just needing oxygen. You might have to go ahead and intubate those patients. Again, guys, follow your local guidelines, follow your protocols when it comes to burns, okay? This, again, key elements you're going to see on test, key elements you're gonna have to review when you're thinking about these types of patients you might encounter in the field. So I hope this kind of rings true to you, and if it doesn't, like I said, go open your textbook, delve into the stuff a little deeper, all right, so you can fully master this content, okay? All right, guys, I'm going to end it there. Be sure to engage with me, guys, on social media. You can get me on Instagram or Twitter. I am at EMS Safe on both of those. You can get me on Facebook. I am at facebook.com/the EMS Professional there. And guys, listen, if you like this type of stuff, you like these videos, you like this type of content, I have a great free area you can go access this stuff. It's at emsseo.com/insider. The link is right here in the bottom of the video. And you can get gigabytes of digital content, hours of audio and video, practice exams, and of course exclusive access to me and other members in the private Facebook group and via email and things like that. So go check that out, guys. It is a free membership. TurboMedics is a premium service, and there is a premium level with a much more content in that level as well. But you get a lot of content in the Insider membership, and I think you will find it very beneficial for your EMS career in helping you move that knowledge needle and perfecting your mastery of content you might be struggling with. So go check that out. Guys, as always, if you have comments, concerns, questions, or suggestions for a Monday Minute, send them over to me. The email is contact@emsofficehours.com. And be sure to go to the website at EMS Office Hours and check out the previous Monday Minutes and the podcast there as well. All right, guys, that is it for me today. Thanks again for watching. As always, I am Jim Hoffman for EMS Office Hours and the Monday Minutes. Stay safe.